Hello, my friends. This is Dr. Richard Miller. If you've ever looked at your medicine cabinet and thought, good Lord, how did it get this complicated? Or if you've noticed yourself feeling a little unsteady, foggy, or just not quite like the person you used to be after starting a new pill, I want you to hear me loud and clear. You are not alone. I see this every single day in my practice. And today we're going to talk about something that far too many older adults never hear in the exam room. We're going to look at 3 common drug combinations that can quietly rob you of your energy, your balance, and your peace of mind. These aren't just minor inconveniences. They can genuinely change how you feel every single day. The tricky part is that most people assume if their doctor prescribed the medications, they must be safe to take together. But here's what we've learned over decades of practice. As we get older, our bodies handle medications differently. That one fact, once you understand it, can be the key that gives you back clearer thinking, steadier steps, and a whole new sense of vitality. We're going to walk through exactly why this happens, what to watch for, and how to have a confident conversation with your doctors so you stay in the driver's seat of your own health. Let's start with the simple biology that changes everything. When we're in our 30s or 40s, our livers and kidneys are like a couple of efficient young interns. They process and clear medications quickly. But as we move into our 60s, 70s, and 80s, those organs slow down, they don't break down, they just work at a more deliberate pace. Medications that used to be gone in a few hours can now linger in your system much longer than they used to. I like to explain it like this. Imagine the highway of your bloodstream during rush hour. If too many medications are trying to exit at the same time, you get a traffic jam. We call this polypharmacy. And it's incredibly common, the dizziness, the mental fog, the fatigue that so many people chalk up to just getting older are very often the result of medications quietly interfering with each other. The good news. Once you see the pattern, you can do something about it. So let's look at the 3 combinations I worry about most with my senior patients. The first one is blood thinners paired with common anti-inflammatory pain relievers. If you're on warfarin, Eliquis, Xarelto, or any anticoagulant to protect your heart, your blood is already being gently kept from clotting too easily. Add ibuprofen, naproxen, or even high-dose aspirin for arthritis or a bad back, and you're giving your body conflicting instructions. The blood thinner is trying to keep things flowing smoothly, while the painkiller can irritate your stomach lining and push the bleeding risk higher. I still remember a delightful gentleman named Harold, 74 years old, who kept telling me he felt washed out and tired all the time. Turns out he was taking his anticoagulant every morning and then popping ibuprofen every afternoon for his knee. Nobody had connected the dots. We switched him to a gentler pain approach, and within 3 weeks, his color came back and his energy returned. It wasn't his heart failing him, it was the hidden interaction. The second combination that keeps me up at night is benzodiazepines mixed with other sedating medications. I'm talking about drugs like lorazepam, alprazolam, or diazepam prescribed for anxiety or sleep, combined with certain sleep aids, muscle relaxers, or even over-the-counter antihistamines like diphenhydramine. As we age, our brains become more sensitive to anything that slows things down. Stack these medications, and you can create profound sedation. That's when falls become dangerously likely. If you're waking up feeling like you're walking through molasses, or if your balance feels off, this is a bright red flag, in my experience. The best solution isn't adding yet another medication to fight the symptoms. It's carefully, thoughtfully reducing the ones that are creating the fog in the first place. The third combination involves certain blood pressure medications taken with potassium-sparing diuretics. These are often prescribed with the very best intentions to protect your heart and manage fluid. But together, they can quietly push your potassium levels too high. That can leave you feeling weak, exhausted, or noticing strange flutters or palpitations in your chest. It's a silent problem, which is exactly why I want you paying attention to it. So what do we actually do about all this? I have a practical ritual I recommend to every one of my patients over 65. I call it the brown bag audit. Take every single bottle in your house, prescriptions, over-the-counter medicines, vitamins, supplements, even that herbal tea you drink every night, and put them all in a grocery bag. Bring it to your next appointment. We'll go through them one by one. I want you to feel completely comfortable asking, do I still need this? Is this working with the other things I'm taking? Is there a simpler way? Your doctor is not there to judge you. We're here to be your partner and your guide. And if you feel like you're on too many medications, that's okay. Just start the conversation with one honest question. Which of these is giving me the most benefit right now, and which ones are we keeping out of habit? Change doesn't have to be dramatic. Small, thoughtful adjustments often make the biggest difference. The patients who do best are the ones who stay curious and engaged. I promise you, nothing makes me happier as a physician than a patient who asks good questions and takes an active role in their own care. Here's the hopeful truth I want you to carry with you. Getting older isn't about slowly falling apart. It's about learning how to maintain a beautiful classic machine. You wouldn't put the same fuel or treat a 1967 Mustang the way you would a brand new sports car, but with the right care and the right understanding, that classic car can run strong and smooth for decades. When you lighten the chemical load on your system, you give your body permission to work the way it was designed to. Many of my patients are stunned at how much sharper they feel, how much steadier they walk, and how much brighter their mood becomes once we clear out the unnecessary medications. You still have tremendous power over how the rest of your story reads. You're not a list of symptoms. You're a person with decades of wisdom, experience, and life left to enjoy. Taking the time to understand what you're putting in your body is one of the most loving things you can do for yourself and for the people who care about you. I genuinely love to hear from you. Have you ever done a medication review and discovered you could safely drop something? Did it change how you felt? Or maybe you have a system that helps you stay on top of all this. Drop your experiences in the comments below. We're building a community here, a place where we can learn from each other instead of feeling like we're figuring it out alone. Thank you for spending this time with me today. If this video gave you some clarity or peace of mind, please share it with someone you love. Health is a team sport, and the more we look out for each other, the better all our journeys become. Stay curious, stay engaged, and I'll see you in the next video. Take good care of yourself.